Hi guys, my name is Mehak and I'm the YouTube content creator. Today I want to talk about discrimination and that it exists on all levels and sadly it doesn't exclude our healthcare and medicine. I want to talk about being a woman and being a surgeon and what it means to be the two together. So over half the medical students at medical school are female. This translates to a third female surgical trainees. And in 2020, the proportion of female surgical consultants is only 14%, which is in keeping with the overall proportion of female consultants in all medical specialties being 36.6%. Given the increased number of female students in medical school and doctors in training, the proportion of female consultants is much lower than expected. So why does this happen? In an article by an association of an anaesthetist, the number of women who dropped off from an undergraduate to a consultant level was described as the leaking pipe analogy. What this means is that women are fed into the pipe at the start of their medical training and can leak out at various stages. This can happen after graduation, after foundation training, core training, or even specialty training. The reasons for this are unclear and complex, but likely more related to the nature of the pipe than women within it. In an independent review on inclusion and diversity for the Royal College of Surgeons, which was published in 2021, our survey findings found that only 1 in 4 women felt they are represented by the college, only 1 in 6 women felt the college did enough to combat discrimination, and only 1 in 3 women felt they are important to the college. The RCS has clearly identified this in the past and runs a Women in Surgery program, which has been highly spoken of by women as per the review. The college has also started a program called Lady Estelle Wolfson Program, which supports women in undertaking leadership roles. But there's still clearly a lot of light to be shed on this issue. And so in the second part of the video, we'll hear from someone who's been through this process herself. We'll hear from Dr Cara Swain, who is a surgical registrar.
Hi, my name is Dr Cara Swain and I'm a surgical registrar based in the southwest of England. I went to the University of Bristol and graduated in 2012. So I grew up in a small town in Cornwall. Both my parents are non-doctors and they were both in the Royal Navy, and I went to a small school, and then when I went on to secondary school there wasn't really a lot of option for what people went and did afterwards. Not really many people in my area went to university, and you couldn't even do A-levels at our school. If you wanted to do your A-levels you had to go to another college. I had wanted to be a doctor since about the age of 5. I remember watching Casualty on the television and thinking it was just the coolest job in the whole entire world. And I used to tell everyone who I met that I either wanted to be a doctor or I wanted to be Jet from Gladiators, if any of you remember that 1990s television show. I had some minor surgeries when I was a little girl, and the surgeon was a gentleman called Mr Mackenzie who worked in a hospital in Penzance, and I first met him when I was about 7, and I told him I wanted to be a doctor, and I remember him telling me that I could do whatever I wanted to do, and he subsequently operated on me 3 times throughout my childhood. And on one of those times he said, if you still want to be a surgeon when you're 16, give me a call and you can come and watch me do some surgery. So that's what I did. I got to 16 and wrote to him, and within about 5 days of sending the letter he phoned me up and said, good, yeah, I remember you, come down to West Cornwall Hospital, you can watch me doing some surgery. And I remember going to watch him doing what I think must have been a hernia operation, watching him pulling out some small bowel and thinking, wow, this is just the coolest job in the world. And I tried to keep in touch with him, and I actually wrote to him again when I got my MRCS qualification, telling him that I'd finally qualified as a surgeon. So he was probably the first role model I met and someone who really influenced me early on in my life. I did my foundation jobs at Derriford Hospital in Plymouth and was lucky enough to do lots of surgical jobs. I did cardiothoracic surgery, vascular surgery and trauma and orthopaedics, and all of those jobs really cemented that surgery was what I wanted to do in my life. I should probably mention at this point that I took some time out after foundation training, and that is because I'm actually a military trainee. I joined the Royal Navy in 2009 when I was at medical school, and I'm still serving in the Royal Navy today. After you complete your foundation training, you participate in your general duties medical officer time. And for that time, I went to sea as the sole doctor on board several different ships, sailing around the world, and really enjoyed that time. It was medically challenging every now and again. It was certainly very rewarding, and there were experiences that I would gladly live through again. I think they made me a better person and ultimately made me a better doctor. In 2017, I applied for core surgical training and then started again in Plymouth and doing my 2 years of core training while I was here. Core surgical training was probably the hardest time of my medical career so far. I found 2 years to do everything that is required of you to get a surgical training number really difficult. As a surgical SHO, I often felt like I was pulled in two directions. You have to be responsible for the wards, you have to support your foundation colleagues, but also you want to learn how to operate and you want to get to theatre as often as you can. And I found that a really difficult balance. It was probably the worst time as well in my life for a work-life balance. I was really consumed with the idea of becoming a surgeon, and I don't know if I could have done it any differently, in all honesty. Somebody asked me how I found it getting a surgical registrar number, whether it was easy or whether it was difficult. I think it's important to say that the surgical registrar numbers change every year and the requirements seem to change very subtly year on year. When I applied, I didn't find it particularly difficult, but maybe that is because I was successful first time round when I went to interview and I secured that elusive number straight away. I really don't want to put people off. Yes, core surgical training was really difficult, but they were also some of the happiest memories in my surgical career so far. I had a really good support network while I was working as a core surgical trainee. I had a group of friends, we all applied for registrar time at the same time. We created publications together, worked together and socialised a lot, and that made a big difference. Hands down, the most frustrating part about being a woman in surgery is the fact that a lot of the time people don't realise you're a surgeon. I've lost count of the amount of times that patients, colleagues and people in the wider world have questioned what I do for a job, or even if I can do it for a job. I've been in the situation where I have introduced myself to a patient, taken their history, examined them, got their imaging, taken them to theatre, done their operation, explained them about it afterwards, and then they've been thanking the consultant the next day and they've not realised that I was a doctor. And I don't know how that is going to change. I often introduce myself to patients as, "Hi, I'm Cara, I'm your surgical doctor." And even then, even after saying those words, they don't realise that I'm the person that's going to be doing their operation. I'd like to address one of the myths that often people interested in a career in surgery hear, and that's that you can't be a good surgeon and pursue a career in surgery and have a family life. I think that's not true. I think we should just stop that right now. At the moment, there's a lot of discussion about taking less than full-time opportunities to pursue a career in surgery, and that's true for both men and for women. I think it's important that we encourage people to do whatever is right for them. Now, for me personally, embarking on having a family is not something that I'm aiming to do, and I often wonder whether that's had an impact on my career decisions within surgery, and it may well have. However, I know lots and lots of women who are excellent surgeons who've chosen to have children at different points in their career, whether that be during core surgical training, during their registrar years, post-fellowship, or even as a consultant, and they're all managing to do it perfectly well. So any myths that you might hear that it's not possible, please put that to bed and don't let that put you off. Work-life stresses and how I deal with them, that is probably one of the hardest questions, because if you ask most people around me, they'd probably say not very well. I think it's important to be well organised, so having a plan really suits me, but the most important thing is having someone to bounce ideas off, talk it out with, whether that be my husband. My parents are still really useful, but also supportive colleagues and mentors. And there are certainly people within the surgical domain who I've found really, really helpful to approach and say, here's an issue that I'm having, how do you think I should deal with it? And I've managed to find those people, both male and female, to be incredibly helpful in my career so far. A work-life balance is really important, and I must say it does become a lot better once you become a surgical registrar, at least it has for me. At this point in time, I'd really like to credit my husband. We met at the start of my core surgical training time, and he's really supported me through my career so far. He's not a doctor. He allows me to vent about work as much as possible, but he also encourages me to switch off and realise that there is a life outside of medicine and we can go off and enjoy things together. And without him, I think I would have found my time as a doctor much more challenging. The piece of advice I wish I'd received, not just at the start of my surgical career, but before I embarked on a medical career in general, is that life isn't a competition. The most important thing is to be true to yourself and to enjoy the journey, and that will make your life so much happier in the long run. Anyone who's ever worked with me has probably heard my advice before. Quite often people that work with me get the world according to Cara, as I like to say. But the most important thing for me is that if you're going to pursue a career in surgery, you have to love it. And that is a very personal opinion, but I think if you don't love it, it's not the career for you. If you're going to do it, you have to commit and be 2 feet in straight away. And if you don't think you can do that, that's okay, but perhaps take a couple of steps to think maybe there's something else that might fulfill you. In terms of my advice for women, I've experienced in the past that women can be really awful to each other in many different domains. I think it's really important that we support each other, and that's the way that we'll get through and improve the career for all of us. A couple more bits of advice. So know your boundaries, learn who that you can vent to, and most importantly, when this career isn't fulfilling you anymore, it doesn't matter. There's always more things that you can do, and get out and go and do something else. Thank you so much for taking the time to watch this video today. I'm always more than happy to talk about a career in surgery, and particularly talk to young women who wish to pursue a career in surgery, and I'm sure my contact details will be available as part of this video. Thank you.